Good afternoon, friends. This is a very short presentation on the IAOS protocol for avascular necrosis of humeral head. The IAOS protocol involves hydrozone arthrodiastasis, alpha 1, 5, 7 blocks, and IAOS EBU, followed by hydrogen and antioxidant drips. This patient developed an ABN of the humeral head, probably because of COVID or COVID vaccination. We know both have caused a great havoc on our people. Vaccines probably have caused more havoc than the disease itself. And this is a presenting X-ray. He was shown to many orthopedic surgeons and every single one of them advised surgery. Here is his presentation video. The normal side he is able to lift up fully, and the affected side is maximum abduction is 75 degrees and forward flexion is very highly restricted. This patient has been advised shoulder hemiarthroplasty, total shoulder replacement, reverse shoulder replacement. I think he has consulted 5 or 6 orthopedic surgeons and every single one of them advised him surgery. This patient does not want surgery and he doesn't want metallic implants in his body. So the next step is I will show you how we give him blocks, how we give him hydrozone arthrodiastasis, and then a short clip about his EBU, his final results. So mixing of the cocktail. Key here is we are using 0.5% xylocaine. So first of all we are taking 2 ml of xylocaine, then we are taking only 0.5 ml of Kinacot, the rest of it we are going to throw away. So we are using 0.5 ml of Kinacot and then we dilute it with about 10 ml of distilled water or water for injection, so that we get a 0.5% xylocaine or 0.4% xylocaine with very dilute Kinacot. And this same cocktail, which is called the Chennai cocktail, is going to be used for the blocks alpha 1, alpha 5 and alpha 7 blocks, and also going to be used for intra-articular injection of shoulder prior to pushing ozone and hydrogen in the joint. So we have now collected almost 10 ml, of which only 1 ml or 2 ml are xylocaine. That syringe is capped and kept away. The needle will be changed subsequently. Now we open another syringe. This is an ozone compatible lower lock syringe and the other syringe is a hydrogen syringe. This is how hydrogen is collected from a hydrogen machine. As hydrogen is lighter than air, we must never turn the syringe upside down. We must keep the nozzle down so that the hydrogen doesn't escape. You can see hydrogen is filling the syringe. 20 ml of hydrogen has been collected and this is a very important step. We attach it to a closed lower bivalve and when we push and see, the hydrogen should just stay in place. Then are the complete steps of how 100 micrograms of ozone is produced. The regulator is kept at 1/8, switch is 9 in Mark 9 machine. Different machines have got different regulator strengths for different concentrations, and once we get a faint whiff of ozone, we attach the syringe and ozone starts filling up into the syringe. We are going to inject only about 6 cc of ozone. So 10 cc collected is enough for this patient. Now the two syringes are locked together to make a double barrel syringe. The hydrogen part is still kept sealed and the setup is handed over to the assistant. We now take betadine and all the spots where we are injecting. This is alpha 1, mid deltoid alpha 5, sternoclavicular joint junction alpha 7, and inside the shoulder are the 4 spots that are going to be injected, which are cleaned with betadine. Now this is alpha 1 injection. We are giving about 2 ml. We use a very thin needle and we have changed the needle. We use a short 26G needle for the blocks and we use a longer 24G needle for intra-articular and hydrozone. Each spot gets about 1 ml, alpha 1, alpha 5 and alpha 7 spots. Once this is finished, we will change the needle because for intra-articular we need to go a little deeper. And again you can see there is a 24 needle. You palpate the shoulder, go intra-articularly and there it is inside the joint. We must not have great resistance in pushing the cocktail in. If there is resistance, means we are touching the bone or head of the femur or glenoid edge. Once it starts growing freely, it means that we are in the joint. We remove the syringe and you can see that there can be a black backflow of the cocktail, which means that the joint is a single capsule and there has been no perforation. The liquid is in the joint. We now attach the double barrel assembly. First, hydrogen is given 20 cc. It is pushed in comfortably. You can see the joint actually expanding from the video I can now see. And once you give hydrogen, ozone injection becomes totally painless. So we have given about 6 cc of ozone and 20 cc of hydrogen. This is just the standard EV procedure. So many videos have been posted. Venous blood is extracted, goes through a pump, goes into an ozonizer, and once it's no filters are used. On the other side is heparin, which is used to ensure the blood doesn't coagulate. You can see the color difference, starking color difference between the venous blood and the blood that is going back, the donor blood and the recipient blood. IAOS EBU systems do not use plastics or renal filters. They use only glass, silicone and ozone compatible material. This is the end of procedure, the base tube, and you can see the white calcific spots which we now have understood are plaques on histological examination. And this is a video of the patient immediately after surgery, after the procedure, where he has been asked to do wall crawling. So he is just using his hand, and for the first time since his disease, he has been able to get his arm above the head. This is of course assisted abduction. He has been brought by an orthopedic surgeon who can be seen in the background and his relatives. He was sent home the same evening. He stayed in a lodge in Palakkad, and by about 7 p.m. in the evening, I asked him to send videos, and you can see the EBU bandages on his other hand, and that's how his movements were. In less than 6 hours after the procedure, from 80 degrees he almost got to 120 degrees. He comes from Andhra Pradesh and has gone back to his village. 3 days later, this is the video he sent me. you can see that he is almost reaching 170 degrees. We did not do any surgery. The patient is absolutely pain free. He has been put on Mukherjee regime for his avascular necrosis. Shoulder, being a non-weight bearing joint, tolerates non-operative treatment very well. A component of his motion is scapulothoracic, but the patient satisfaction is immense and he has avoided a major surgery. This is a teaching video from IAOS for medical personnel only. A proper consent for the video with the face of the patient has been taken and he has agreed for this to be distributed to medical personnel for learning. Medical personnel, therapists and those interested in molecular therapies and these techniques can please message me in WhatsApp. Phone calls, voice calls are not answered on this number. This number is exclusively meant for WhatsApp messages only, and this is a number on which you can message and your query will be answered within a reasonable time. Thank you very much for sparing your time and listening to this lecture. Indian Academy of Orthopedic Surgeons is one of the most active and largest academic bodies propagating orthopedic knowledge in a true scientific fashion. Thank you.